Hi and welcome to my channel. My name is Lethukwenama, Letwalo, and people call me Letu. You're welcome to do the same. I'm a girl from a small town called Bergville in KZN, and I'm currently doing my final year in medicine at Stellenbosch University. I'm here to share a short, simple video on contraceptives, which is a way to prevent you from falling pregnant. Right, so let's get straight into it. This is something that I've been passionate about, something that I've been wanting to do for a very long time, to campaign and advocate for contraceptive use in young women, right? And I'm so excited that now I have this platform, right? South Africa is a country that is known with a high teenage pregnancy rate. So I want to be part of the solution, to equipping young women with information that they need to know, with empowering themselves so that they don't fall pregnant unplanned. So if you're that woman, this is a platform for you. We're gonna start off with the pill, the famous pill. They come in boxes like these, obviously with different names and boxes of different brands, and some of them look like this and some look like this. So there's a few different options. If you look closely at this one, there's different colors and it's written triphasal. So there's tri, bi, and monophasal. And what this means is that each set of colors on the tray has different dosages of the hormone. So we call them COCs, which means combined oral contraceptives. Right, so this is freely available at all clinics. And another important thing with oral contraceptives is that they also use for skin. So a lot of people who have skin problems and acne, it usually works for them. It helps clear the acne, and if that doesn't work for you, there are also other options for your acne. All right, so what you must know with this pill is that you must take it at the same time every single day. Either you're setting an alarm for 7 a.m. or 8 p.m. or in the afternoon when you're having lunch. Make sure you're taking it at the same time. And if you forget, maybe it's a few hours later, you can still take it. Maybe you forgot yesterday, you can still take 2 the next day. But then if it's for an extended period of time, then you can consult a healthcare worker and they will advise you further. So with these ones, they also help regulate your cycle. So if you have an irregular menstrual cycle, maybe sometimes you bleed for 5 days, sometimes for 9 days, or you don't know when your period will come, you get a lovely red surprise every month, then these also help regulate your cycle. So you know exactly when you start your period, when you end it, and that's what it does, So for some people, it causes a lot of weight gain. And this is because it increases your appetite. So you eat more, which means you're more likely to gain weight, which is, I guess, an incentive to just exercise and be more physically active. All right, moving right along, we are going to talk about the Implanon. Yes, I thought it was upside down. So inside this box, this is what you find. So this is one of my favorite ones. There's this gun device, this is it, and it is a very small rod with hormones that is inserted just under your skin, right? This is what it looks like. There it is. Let's see if you can see it properly. You see that protrusion there? So that's the small rod, and it releases the hormones slowly into your body, and it lasts for 3 years or 5, depending on which one you decide to choose. So that's the very nice thing about this one, is that you don't have to remember to be taking a pill every single day, because it lasts for a very long period of time, right? So with this one, people sometimes get spotting, where it's just the little spottings on your underwear or panty liner, and sometimes this can go away, and sometimes you just need to use oral contraceptives, which they also provide at the clinic, and this helps maybe just stop the bleeding. And yeah, so some people also complain about weight gain. Same with the oral contraceptives, it increases your appetite and you also might gain weight. So the nice thing with this one is that it is one of the most effective methods of contraceptives, and it lasts for a long period of time. Cool. And then the injection. So the injection comes in a 3-month or 2-month injection. So this is the depot. You might know about it. Excuse me. Depo Provera, or this is the 2-month one. So they come in vials like this, and they inject it every 2 or 3 months, depending on which one you choose. And these are also quite effective. A lot of women choose them, especially after giving birth. So a lot of women opt for this option. And yeah, so with them as well, you just need to remember that I need to go to the clinic because I'm now due for my next injection before you get a mistake, right? Okay, cool. So just remember to do that as well with those. And with those as well, there's also increased appetite, which means some weight gain, which means lack of exercise. Yo, I just said lacquer. That's Stellenbosch. Sheesh, guys. And then in a box like this, you get your copper T device or your hormonal intrauterine device. So the group of these are called IUDs, intrauterine devices, and they come in that box that I just showed you. And inside the box, this is what you find. If you look closely, so these are tubes. Don't mind all the long tubes and things they use to insert them. So if you look here, this T-shaped thing ending here is what is left inside your uterus. So with the hormonal one, it releases a hormone, and then with the copper one, it causes an inflammatory reaction in your uterus that kills the sperm, so that fertilization doesn't happen. So fertilization is when the egg of the woman and the sperm of the guy come together, and then they start to form a baby. So that doesn't happen, right? So other options could be a patch. So a patch is one that it's a superficial thing that you put on your body. So also not the most effective, because you know it can fall off, it can be detached. So with that one, you use it for 3 weeks, and then you have to go a week without it, and then for another 3 weeks again. Yeah, so let me know which option that you have used, you know, which type of contraceptives you've been using, how you've reacted to them. Are you liking it? Are you enjoying it? Because I think it's about time that we stop with pregnancy scares, you know. If you don't want to fall pregnant, then go on a contraceptive. If you know you're sexually active and you're not ready for a baby, then use a contraceptive. And you don't want to be missing your period for about 2 days and being worried. Now you're buying pregnancy tests and you're not sure what's going on. So that's not a nice space to be in, right? So also condoms. So condoms are readily available in most bathrooms. They're female and male condoms. So these are the only form of contraceptives that are effective against STDs or HIV. So please use condoms. You don't want to get STDs. Right? And some people just don't disclose whether they have STDs or they are RVD positive. So just make sure that you're using condoms, and just know that they're not the most effective method of contraception. So use condoms and then supplement with any of the contraceptives that we've just spoken about now. Right. And then for the men, please use condoms, yes. And also there's a vasectomy option, which is a surgery that is done so that you also don't have babies. And then with women, the surgery that is done is tubal ligation. So they tie off your tubes so that you also don't make babies. So those are permanent methods when you decide that, you know what, my family is big enough and I don't want to have any more children. And this is what I'm going to do. So usually older women go for that option. But yeah, so those are the options. And just know, you know, there's a lot of misconceptions around, you know, contraceptives, the way they react and the side effects, etc. Just know that we all have different bodies and react differently to different things. Just because your friend had these side effects doesn't mean you're going to experience it the same. So don't not use contraceptives because of what you hear, because of, you know, a lot of myths that are going around. Just get yourself informed and get yourself empowered, you know, so that you have your life on track. And babies are expensive. My bundles of joys are very expensive. So let's try not to have babies unless we have planned for them and unless we are ready for them. Right. So this is for the healthcare workers. Fellow colleagues, let us do better. You know, let us make our healthcare centers comfortable environments for women to come and seek help. So a lot of women don't use contraceptives because of how they're treated at hospitals, at clinics, healthcare centers, because of our attitudes towards contraceptives, towards them using contraceptives. But then we also judge people when they're pregnant. So there's also double standards there. So we just need to address that and just do better. You know, we should treat people as patients and not our child, and not judge people. So let us do better on that aspect and make sure that we explain things clearly to our patients. And to everyone, just get yourself informed and use contraceptive options. So let me know about your experiences. Let me know what you're using and what you're thinking of switching to, what experiences you're having at the moment. And yeah, I'm very excited to hear your feedback. Please share this with other women. Make sure they're also empowered. Make sure that they're also not falling pregnant unplanned. And let's just make sure that, you know, we're looking out for each other. Share it with your friends, your family. And don't forget to subscribe down below, please, and just like this video. And I'm really looking forward to seeing you on the next one. I hope this has helped you, and I hope you've learned something. And